Hey there, this is Dr. Daniel Farkas, DC CFMP, and I want to talk today about GI problems, just gastrointestinal problems of all different types and sorts and categories, and kind of how to sort through and what to think about them, and how to think about taking action, where you might get help, who might be able to help you, who might not be able to help you, and just what you do about it and what you can do on your own. So GI disturbance problems, anywhere from they range. You can have something serious like inflammatory bowel disease, like Crohn's disease, colitis, ulcerative colitis. Those things can lead to worse problems. Yes, it's true. Going through the inflammation process and into the resolution, or what they call the remission process, over and over and over again. Yes, people can develop issues like cancer. It can evolve into that, that's for sure. Those types of problems cause pain. They cause constant bloody, watery, loose stool, and they require lots of different types of medications that break up the inflammation cycle. Some people have to use suppositories. The drugs can get expensive, and some people with a decent diet and decent lifestyle, low stress, exercise, they're able to control it or minimize things. And so, in all these things that I'm talking about, there's no cookie cutter recipe for anything, for help or anything, and everybody is very unique. But inflammatory bowel that can lead to more serious life-threatening problems, I'd say that would be the big concern. Very, very life-threatening, of course. Then there are the annoying problems that can really wreck your life too, as well, or just really bother you. And a lot of times those are categorized as things we call IBS, which just means irritable bowel syndrome. And so a syndrome just means a collection of symptoms. It means either alternating constipation and or diarrhea. It kind of seems like everybody's had IBS at some point in their life. So some people have really loose bowel all the time and pain and cramping, and then it stops, and then it can come back again, and then it can cycle back to constipation. Then there are people who have constipation all the time. Sometimes they'll be constipated for days or even weeks at a time, and then things can get better. Those people use things like laxatives. They often end up at their gastroenterologist asking for help, and there's not much that they can offer except in the way, of course, of laxatives, magnesium, and things like that. Now, there are some other conditions that come about too as well, such as something called SIBO. That's known as small intestinal bacterial overgrowth. SIBO means that bacteria that are only kind of supposed to live in the large intestine have migrated and have snuck into the small intestine. So the way your GI tract works is you have your mouth, your throat, then your stomach, then your 30-foot long small intestine. Very few bacteria are actually in there. Less than 10% of all your GI tract bacteria are in there. The other 90+% are in the large intestine where your stool is made. Well, those intestines are supposed to be separated by a big valve at the end of your small intestine and beginning of your large intestine. It's called the ileocecal valve. And sometimes due to stress, that valve won't stay closed like it's supposed to. And due to stress, we won't digest, and we don't make enough digestive enzymes, acid, and bile to even break our food down properly. So it kind of ferments and gets gross in the small intestine, and all this can lead to bacterial overgrowth. So condiuse is something that's so common, it's unbelievable. PPIs. Those are called proton pump inhibitors, and those are things that decrease the amount of acid that your body secretes. So just imagine you're taking a drug to try to help with something like acid reflux, for example, very, very common. These things are like things like pantoprazole or omeprazole. There are a lot of different ones. And they make it so that the body just doesn't break its food down properly. Again, you get fermentation and overgrowth. And it seems that the SIBO is so consistent with PPI use that if you have used a PPI, it's standard to say don't even bother getting a SIBO test for at least 6 weeks until after you stopped a PPI, because it'll show positive. So, or what they call a false positive, but it'll show positive, frankly, because it facilitates SIBO. SIBO are very common. It causes constipation, and bloating is the common sign of it. But what's interesting is that anxiety can also accompany SIBO too as well. And again, this one's really driven by stress. Now, of course, there are things like ulcers. that can be that occur in the stomach primarily, and those can be caused by something you might have heard of called H. pylori. Also, for the big word is Helicobacter pylori. H. pylori is an organism that lives in the wall of the stomach. It doesn't like acid. It tricks the cells that line your stomach into not making and secreting acid, and that in itself causes and can contribute to acid reflux. It can also contribute to ulcers too as well. Now, ulcers got to be very careful with. Some can bleed seriously. Those require close monitoring, visualization, and close management, special diets, of course, too as well. But there's natural support to help those heal too, using things like glutamine and zinc carnosine. But back to the H. pylori, what's interesting and how it pertains to acid reflux is that there's something important we got to understand. I'm talking about this because acid reflux and heartburn, even what they call silent reflux, is so common. Silent reflux is having all the symptoms of acid reflux, but not having the burning. You have the throat clearing, the constant drip, throat hurts, chest hurts, breathing problems, all that. But some people just don't, they have all the symptoms, so they don't have the burn, so they call it silent reflux. So again, the big thing to understand about acid reflux and also how H. pylori relates to it is that acid is required to be made by your stomach to trigger contraction of a valve that's at the bottom of your throat and the top of your stomach called the lower esophageal sphincter. That requires acid to get stimulated to close. So just imagine if you're taking something that decreases the amount of acid that you're producing, or there's an organism like H. pylori in place that decreases the amount of acid that you're producing, you are likely to get reflux or silent reflux. This is very, very common, and it's counterintuitive because frequently we're finding more and more that people think, I have too much acid, that's why I have reflux. And the answer is actually, the truth is you don't make enough. And that oftentimes is driven by stress. And when I talk about stress, not making it so that you don't make enough digestive enzymes, acid and bile, just understand that when you're exposed to acute or chronic stress, even if things are good, even if you're just very busy and things are really good, your body will make less of those things because it just can't do everything at once. It can't run from a tiger and deal with your busy day and get poor sleep and mental stress and all these things out there in the world, and also run your digestion very successfully. Everybody knows if you get caught in a moment of severe stress, like abrupt stress, you can feel your mouth dry up. You can feel your stomach cramp immediately. What you're feeling is your body reacting appropriately and turning off your digestive system so it can respond to the stress. But sometimes we live like that. So we end up with things like SIBO, small intestinal bacterial overgrowth, and acid reflux too as well. So those play a huge role in this whole stress spectrum that people have. And so to summarize, we think, let me say this too, let me talk about antibiotics. Antibiotics, a great invention. They help save lives. But we know that they are used very, very liberally. There's a purpose to antibiotics to kill off infections. The problem is they kill off healthy good guy bacteria. Now, the bacteria that live in our gut, they're resilient and strong, but they're meant to be balanced. And if you wipe out a whole bunch of good guy bacteria, you can have obnoxious bacteria that cause problems sneak in and take their place. Now, understand this is something a lot of people haven't heard of. Bacteria communicate with the brain and the immune system and the hormonal system, all these systems in the body, primarily the brain, of course. The brain is listening to bacteria in the gut. The trillions and trillions of bacteria in the gut all have a voice, and they all talk to the brain. They send messages up a nerve called the vagus nerve, VAGUS. That's the gut-brain connection, if you've ever heard of that, the gut-brain connection. The brain is listening intently to the bacteria in the gut for how the brain should act and how it should direct the immune system and the hormonal system and more. And furthermore, the bacteria that live in the gut, they make 90% of the chemicals that runs our emotions and our behavior. And those are called neurotransmitters. Things like dopamine that control how happy we are, how focused we are. Serotonin that controls whether or not we're anxious and whether or not we sleep well and focus too as well, and a whole bunch more. So I want to say that again. Bacteria that live in the gut that aren't human make 90% of the chemicals that controls our emotions and our thoughts and our focus and all that. It's not a theory, that's a fact. That's how it goes. So you could imagine the effect that antibiotics could have on these. Sure, it's a great idea to wipe out and kill bad things, but when you damage those and affect those, that's where many people take antibiotics and their health and their mental health and behavioral health, physical health, everything, it just, immune health, it just spins out of control. And understand too that 1 out of 5 pediatric emergency room visits is due to antibiotic reactions because they have undeveloped systems and they get antibiotics, and sometimes they get a lot of antibiotics for their ear infections, skin problems, and more. So far I talked about inflammatory bowel, I talked about irritable bowel syndrome, I talked about SIBO, I talked about H. pylori, I talked about acid reflux, and then I talked about how you could just, I started talking about how you could disturb these things with things like antibiotics and what stress does too as well. So now I want to give some positivity here. What do you do about it? Starting at the top, I love the field of gastroenterology. They save lives. They detect colorectal cancer, which is a common killer that strikes very fast. And I think that everybody should get a routine colonoscopy every 5 years minimal, unless you have something more advanced going on that should be monitored more. But nobody can be great at everything and do everything. I certainly can't. And where they're not suited for is bringing things into healthy balance. And I think they would probably admit that. And they say, look, we can save your life. We handle big problems. But if you're having problems with stress, with digestion, with SIBO and all these things, yes, they try to use their antibiotics, their steroids, and their PPIs and other drugs to try to help. But oftentimes it doesn't really bring things into balance. So the good news is that's the bad news. The good news is there is advanced help that's available. And there is advanced testing you'll find, from like alternative healthcare practitioners that use advanced stool testing to actually measure the populations of the good bacteria, the bad bacteria, and survey the entire GI system in a way that ordinary gastroenterologists just do not. And in addition, those types of practitioners are more likely to know exactly what type of all natural things to recommend to help to heal up the wall of the gut and bring the bacteria back into balance. So again, certainly gastroenterologists, certainly easily capable and intelligent enough of doing things like this. But again, everybody can't just do everything. You can't be a great electrician and plumber and roofer and painter. You just, in finished carpentry, you can't, you just can't do everything. So that's where alternative healthcare comes in. And I found it to be very rewarding, helping people once they've seen their gastroenterologist and ruled out serious disease processes or got the appropriate diagnoses. Then we can start the process of looking real deep into what's going on using advanced stool tests, advanced food sensitivity tests, and more to take an honest look at what's going on. And then what's real exciting and encouraging is that then we start to talk about how we can apply very specific lifestyle recommendations just to have healthy boundaries about stress, to stop activating those systems in the body, to stop keeping our body stuck in this fight or flight mode that prevents normal digestion. And that takes me to another topic of the exciting field of what we call functional neurology. So far I've been talking about functional medicine using advanced testing beyond ordinary medical testing and natural support, but functional neurology is all about consciously stimulating the nervous system to come back into balance. And it's easy and it's kind of fun. It takes the right analysis. So I love doing simple analyses with my clients and saying, here, let's analyze and kind of check and see how your brain's working and how well it's communicating with your gut or not. By just even having people check and do simple things like, can you gargle water for 30 seconds, like properly? Can you even hold your breath for a minute? Can you do some simple balance exercises with eyes open and closed and a simple brain teaser? And I have people of all ages that fail those tests terribly sometimes, but it's okay. I tell them, I say, don't worry. I can start to tell you some simple but what I call brain-based therapies, little fun, little exercises to do daily to stimulate this and stimulate the system back into balance so that your brain and gut can start to communicate again. Just like two people in a healthy relationship communicating properly to address the imbalance in the nervous system. I'm telling you, it's easy and it's fun. That along with precise natural support. from the functional medicine world, using advanced things, especially for inflammatory bowel disease. We call it medical foods. So I'm going to talk about like supplementation and support now, and I'm going to start with medical foods. It's an interesting nickname that Big Pharma came up with these things. There's no medicine in theirs. It's not food. It's not like a banana. But what they are specific powder blends that are designed for very specific health conditions, such as inflammatory bowel disease. And I've seen many times over where these things ended up becoming substitutes for inflammatory bowel disease medications and steroids and all that. And then, of course, we always encourage people work with your prescriber before you go changing anything. But it's very routine that when people practice the appropriate lifestyle recommendations and use their medical foods properly, do their brain-based exercises, it is quite rare that you don't see improvement or very, very significant improvement. And some people can actually get away from their medications and use lifestyle recommendations, use proper diet, which is not that hard, just major do's and don'ts. Use medical foods, precise probiotics, and powerful natural anti-inflammatories and immune boosters, as well again as those brain-based therapies from the field of functional neurology. And they can really get into a place that, like I say, the ordinary approach just doesn't provide for, because the providers just don't have the time or the resources to do that. So I just want to give you some hope here that if you're struggling with any of these things, whether it's acid reflux, IBS, IBD, or something you're not even sure, or SIBO, or you're just not even sure what it is, that there are ways, and there is advanced testing, and there are ways to know for sure if you have that. And then there is always natural support available too as well. There's always, for all these problems, there's natural support that's very effective too as well, whatever it is. But just understand that the concept of ordinary healthcare, which is crucial to rule out pathology and life-threatening illness, and functional medicine that uses advanced stool testing and more, and advanced things like medical foods, precise stair-stepped probiotics, advanced anti-inflammatories, and advanced immune support, and those crucial brain-based therapies from the field of functional neurology. All this stuff is available. Just know that, and know that you can learn about this stuff and you can get a handle on this, and I believe that improvement is possible. So that was a lot. I'm glad that you made it to the end of this message, and just know that there's help available. Please reach out to me. I'm easy to find, and no matter where you are, we can find help for you nearby if we aren't able to, just to at least guide you. I tell everybody, I go get a hold of us. No matter where you are, we'll point you in the right direction. I'm real passionate about helping people wherever they are. So I'm Dr. Daniel Farkas. Be healthy.